Anyway, new research published this week found that heart disease is responsible for a quarter of all deaths in the UK, the equivalent of one every 3 minutes. But a pioneering British health tech company, PocDoc, is hoping to take some of the pressure off the NHS with the launch of the world's first smartphone-based cholesterol test, where users are able to test themselves using a lateral flow test device, with the app providing results within 6 minutes. Well, joining me now is Steve Roest. He's co-founder and chief executive of PocDoc. Steve, welcome to you. So you clearly think the moment has arrived for personal diagnostics. Was COVID a turning point in that respect?
Well, first of all, it's great to be on the show. We're very excited about the developments at PocDoc around the world first ever smartphone-based cholesterol test, and we think it can make a huge impact in the fight against what is the nation's biggest killer, which is cardiovascular disease. COVID upended all of our previous notions around what the nation requires in terms of healthcare response. It's made some things much better, but it's also made some things much worse. For example, the backlog around laboratory testing and screening for cardiovascular disease, in effect, fell off a cliff. And it is now an all hands to the pumps moment about how do we get out there with the message around cardiovascular screening, and we try and address this major issue of cardiovascular disease, which actually is not just an issue across the nation, but it adversely affects a number of health inequality issues as well. So it really is a major priority. And the biggest single factor in that is access to lipid testing. And the PocDoc smartphone-based lipid testing using the PocDoc app, as you say, provides the full 5-marker lipid panel within 6 minutes, as well as an overall health assessment. So we are very excited about rolling this out across the country through our partnerships with the NHS and with pharmacies and other healthcare providers.
So take it back to basics here. You're using a lateral flow test device and your smartphone. Talk me through the process.
So traditionally, lateral flows have provided yes-no response. Yes, you have COVID. No, you don't have COVID. Yes, you're pregnant. No, you're not pregnant. We've innovated in our research and development facility, which is Cambridge. We're a UK-based company, UK-based born and bred, UK manufacture, UK assembly. So we're very proud to be British. And we've innovated on the traditional lateral flow technology to be able to provide a quantitative result. This is extremely important when you're dealing with something like cardiovascular disease, where you need to know the exact level of these cholesterol markers in order to be able to correctly treat and pass each person through the pathway and assess risk and what that person needs in terms of follow-up care. Without our innovation in our R&D facility and our fantastic team in Cambridge, we wouldn't be able to be doing this. And so being able to provide quantitative responses on lateral flow testing means that we've unlocked the huge affordability and scalability that lateral flow possesses, and combined it with our computer vision, AI, and image analysis diagnostic cloud to provide a truly world-first, highly scalable solution to dramatically increase, a step change increase in access, which is what's required around lipid testing, not just in the UK, but also in the United States.
How much would you look to sell each test for?
So at the moment, we're distributing through healthcare providers. So we're very conscious that we want to work within the system. As I said, we were selected for the NHS Digital Accelerator as one of the pieces of technology the NHS wished to advance or accelerate through the system. We're partnered with Novartis and Chelsea and Westminster. And we're also working with chains of pharmacies across the UK. So at the moment, you can use the PocDoc test in our pharmacy partners for around £15. Obviously, through the NHS, that's free at the point of care. And we hope to be able to roll that out, the NHS-related partnerships, before the end of the year.
Is it at all, I mean, it sounds a terrible thing to ask you, but I mean, is there a risk of it being error prone? I mean, you're asking patients to essentially take a sort of little sample of their blood and feed it into the device. I mean, a lot of people will probably find that quite stressful. It's perfectly possible they may make mistakes along the way.
Well, so that's why, first of all, we're CA marked, registered with the MHRA. We've done extensive clinical testing with our partners within the NHS, actually using NHS patients. So we have extensive clinical data and usability data around that. The key thing to understand is that our strategy around rolling out with healthcare providers means that we're going through and addressing all of those concerns in advance to make sure that we're truly delivering the right solution in the right way to the right patients. So whether that is testing at home, whether that's going into a pharmacy, whether that's going into a community center, or whether that's even staff using PocDoc to go out into hard to reach communities that are traditionally beyond the reach of primary care, to go and test them and leave them with tests. This technology, by combining lateral flow with smartphone-based image analysis that happens in our diagnostic cloud, it unlocks this ability to go and deliver this step change in access, which previously wasn't available. So, for example, we can do in minutes what sometimes might take weeks in a laboratory, even if you are able to get an appointment for that. So I think that as you can see from our relationships across the board with healthcare providers, there's been a huge awakening after COVID around the fact that the way that it's currently being done in terms of testing for cardiovascular disease isn't up to scratch, and we need to think about other methodologies and other ways to really go out there and deliver this step change increase in access, and that's what PocDoc does, and we're very excited to be able to do that.
All right, Steve, good to hear from you this morning. Thank you.
Thank you.